Now we'll discuss about the anatomy of the tongue. Before starting the discussion about the gross anatomy of the tongue, I would like to mention something about the development of the tongue. Here, this is developing embryo. This is foregut. This is foregut, this is midgut, this is hindgut. This is developing embryo. Here you can see this is developing foregut. The cranial most part of the foregut. Here a series of thickening appears from the pharyngeal arches. If you got a section like this, you will find a series of thickenings. This is endodermal lining, which covers from inside. This is ectoderm. This series of thickenings form the pharyngeal arches or bronchial arches. So this is first, this is second, this is third, this is fourth, and this is sixth pharyngeal arch. Fifth disappear just after its formation. So this is first, second, third, fourth, and sixth arch. This is first, this is second, this is third, this is fourth, and this is sixth arch. Here is midline. In midline there is thickening appears. This is tuberculum impar. This is tuberculum impar, and under two swellings appears. These are two lingual swellings. These are lingual swellings, and this is tuberculum impar. This is tuberculum impar. And just after this, there is a foramen. There is a foramen known as foramen cecum. This is foramen cecum. Here is a foramen cecum. This is foramen cecum. Here, thyroglossal duct develops, descends from this foramen and form the thyroid gland. So these are two structures. One is tuberculum impar, and these are two lingual swellings. And another thing which appears here, that is hypobronchial eminence. Here is hypobronchial eminence. This is hypobronchial eminence. This part is hypobronchial bronchial eminence. So these structures forms the tongue. Before discussion about the tongue formation, we'll discuss about the nerve of each pharyngeal arch. Nerve of the first pharyngeal arch, this nerve is here. The nerve of first pharyngeal arch is mandibular nerve. This is mandibular nerve. Nerve of second arch, this is facial nerve. Nerve of third arch, this is glossopharyngeal nerve. This is glossopharyngeal nerve. Nerve of fourth arch, superior laryngeal nerve. Superior laryngeal nerve. Nerve of sixth arch, recurrent laryngeal nerve. Laryngeal nerve. Here, this facial nerve gives a branch known as pre-traumatic branch. This is pre-traumatic branch which gives supply to the first arch. This is pre-traumatic, this is post-traumatic. So, first arch is supplied by two nerves, that is mandibular nerve and this pre-traumatic nerve. This nerve is known as cardia tympani. This pre-traumatic is known as cardia tympani. So first arch is supplied by two nerves. Nerve of arch is mandibular nerve and another nerve is pre-traumatic nerve, that is cardia tympani. This is a branch of facial nerve. So after this, we'll discuss about the formation of the tongue, how tongue is formed. So now these structures, these are two lingual swellings. This is tubercular impart and this is hypobronchial eminence. If you separate these structures from this diagram, you will find these two swellings. These are two swellings. These two swellings, lingual swelling, and another is tubercular impart. This is tubercular impart. Here is position of foramen cecum. This is foramen cecum, and this portion. This is hypobronchial eminence. This is hypobronchial eminence. This hypobronchial eminence is divided into two parts, cranial part and caudal part. Now, these structure gradually enlarge. This become enlarged and it forms like this, and here this structure become enlarged and it become like this. Now these parts joined with each other, and here the median septum is formed, and this portion also enlarged like this. This portion become cup shaped. This is known as cupula. It become like this. If you draw the structures separately, you will find these are two lingual swelling which joins with each other, Here is tuberculum impar. Here is foramen cecum. This is cupula, and here is epiglottis. Gradually this portion become disappear, and it reaches up to here. So this part form anterior 2/3 of the tongue, and this part form the posterior 1/3 of the tongue. This part form the posterior most part of the tongue. This is posterior most part of the tongue. So tongue develops from these structures like this. Sometimes these two portions do not join with each other. These two lingual shenings do not join with each other. Then tongue become bifidus tongue. This is bifidus tongue. So these are some clinical importance. There may be sometimes tongue is very large, sometimes tongue is very small. So there are so many variations. There is tongue tie also. So this is all about the development of the tongue.